Hello everyone, today's video is about hernias. So there are several kinds of hernias and we're going to cover the two most common kind that we deal with in the office with babies, and those are umbilical hernias and inguinal hernias. Now today's video is not going to cover congenital diaphragmatic hernias, which are a much bigger deal, and hopefully your baby would have been diagnosed in utero and born at a university medical center because they would require a lot of intervention early on. It is extremely serious. The two we're going to talk about are usually not nearly so serious. So the first one is, I want to cover because it's so very common, umbilical hernias. So you know umbilical means belly button. Well, imagine when your baby was still in utero, the umbilical cord obviously had to go through this tiny little opening at the belly button called a fascial ring, meaning that the fascia there has a little ring that allowed the blood vessels to go through. So you remember in the umbilical cord we have two arteries and a vein. I always remember that as AVA, A-V-A, because there were two arteries and a vein. It helped me remember that. So those had to pass through that fascial ring. Well, after the baby's born, the straight muscles in the abdominal wall, or the rectus abdominal muscles, they gradually start growing back together where they had been slightly separated, and as they do that, they sort of pull together the edges of that fascial ring so that it closes off and there's no ring left there. But early on, and in fact umbilical hernias can last for several years, they almost always close on their own. I always joke that we'll definitely get that taken care of by kindergarten, but we drag our feet on purpose as far as referring you to a pediatric surgeon because they so often just take care of business on their own, and we don't have to worry about the risks of anesthesia and the referral to ped surgery because it goes away by itself. Now, we have seen over time that typically African American babies can take longer for those rectus abdominal muscles to close together for some reason. And so I feel like I've more often had to refer them to a ped surgeon if they were getting to be, 4 years old or around there. And it's a relatively simple procedure that the surgeons would do to pull those muscles together and tack them together so no intestines could bulge out. So what the hernia itself is just the word itself means things are bulging out from areas which they should not be. And so let's imagine you have that little ring in the belly button area, and you have the intestines, there's an opening, and so if the baby coughs, cries, strains to have bowel movement, whatever he does to increase the intra-abdominal pressure, then those intestines can kind of squish out through that hole. Now remember, the hole is large enough that it's very easy to reduce. So we use that word a lot. Reducing a hernia means that you can gently press and then you can put it back down. So umbilical hernias are typically very easily reducible, as opposed to the next kind we'll talk about in just a moment. And so if you see a large bulge around your baby's belly button, it may be an umbilical hernia. But these do not get what we call incarcerated. That's a funny word, sounds like they're in prison, and it's kind of what it means. Incarcerated means those intestines would bulge out somewhere and then get trapped, and that could cause them to not be able to properly venous drain. The blood couldn't get out of the tissue, and blood could keep getting in, and there could be necrosis and death, and it could be a surgical emergency. Well, none of that happens with umbilical hernias. The defect is large enough that the intestines easily go out, go in, they're always easily reducible. That's not our concern with those. Now, in contrast to the other kind of hernia that babies can get. Now, girls and boys can get umbilical hernias with this other kind of hernia called an inguinal hernia. More often it's in boys. It is possible in girls, but it's more likely in boys. It's more likely in extremely premature infants. A lot of centers screen very carefully for hernias, inguinal hernias in premature infant boys because they're so likely to go home and then develop them and have to come back to get a repair. So imagine when your little baby boy was still in utero, the testicles started out in the abdominal cavity and then descended down into the scrotum, leaving behind sort of a trail. Well, an inguinal hernia is when the intestinal contents can bulge down sort of into that trail. And so what you might see is when you change your baby boy's diaper, one side of the scrotum is just obviously markedly enlarged compared to the other side. And those can also be reduced usually very easily but they're at much higher risk for becoming incarcerated. In other words, the tissue going down that little tunnel, getting stuck and not being able to be reduced back into the abdominal cavity. So we would refer to a pediatric surgeon for repair much more urgently, not emergency room basis if we find that on exam or the parent says, hey, we've noticed one side's larger than the other sometimes and then it goes away. We would refer that to a ped surgeon for evaluation on, within the next couple weeks sort of urgency. Now, what if your baby boy did have an inguinal hernia and you happen to change the diaper and half of the scrotum looked discolored, bluish, was very firm to touch or warm to touch and bright red, and you couldn't gently reduce it down? Now that is an emergency, and that would deserve an urgent trip to the emergency department to consult with a pediatric surgeon. So I always throw this in there, but you guys know if I would ever say to go for a pediatric reason to the emergency department, I would encourage you to find an actual pediatric emergency department. I have so many friends, I know so many fantastic rural hospitals that just don't have those pediatric resources, particularly a whole group of pediatric surgeons sharing call to cover these sort of emergencies. So please understand when I say that, I'm talking about a pediatric emergency department. Now, as always, this is general medical advice. I can't possibly give you specific scenarios and adequate information. I'm just trying to educate and hopefully reassure, especially if your baby does have one of those umbilical hernias. As always, you have to consult with your individual pediatrician about any of these sort of circumstances. So I hope that cleared that up for you tonight, the differences between umbilical hernias and inguinal hernias. Much less concern for the umbilical. Occasionally need surgical repair if they don't go away on their own by around age 4. And inguinal hernias, more likely in boys, and could be rarely an emergency situation, but generally a casual referral to ped surgery to take care of those sooner rather than later. Thanks.